The Ministry of Health has confirmed community spread of COVID-19 in Grenada. Acting Chief Medical Officer Dr. Sean Charles said Friday that the patterns emerging from the current spike in COVID-19 cases point to community spread. Prior to this, Grenada recorded specific clusters of positive cases which were either directly linked to an imported case or a traced contact of a confirmed case.
In addition, we note that the places where the cases come from, the number of places have increased. So we now have cases from St. George, St. John, St. Andrew, St. David. All right, and when we receive the results that are pending, it is anticipated that every parish on the mainland, at least, will have cases. So far, we have had no reports from Kerriakou and Pitimatnik, but we continue to be vigilant. We continue to test. We continue to monitor. From the patterns that we are observing, it is evident that we have a degree of community spread of COVID-19, albeit at low levels at this point in time, right? But we do have this type or this pattern of transmission at present. We are unable to link many of the cases to any defined cluster or to a traveler. Hence the reason why we have determined that this is where we are at present.
Infected persons range in age from 4 to 71, and at present, there are more female positive cases than male. Additionally, the vast majority of positive cases are unvaccinated persons, many of whom are exhibiting mild symptoms. Dr. Charles explained that infected persons usually develop symptoms within 2 to 14 days of exposure. Therefore, there should be no rush to test immediately after exposure, as this could lead to a false positive. He further stated that based on the incubation period for the virus, testing is typically done between 5 and 7 days after exposure.
The symptoms that persons may develop may include fever and chills, or fever with shivering, cough, shortness of breath. Now, these were the classic presentations of the disease. What we are noting particularly is that persons are presenting with muscle and body aches, headache, fever, runny nose, congestion, sore throat. Some persons present with upset stomach or nausea, vomiting, and diarrhea. These are common symptoms of this disease that we are seeing in the population. So anyone displaying these symptoms, all right, it is highly likely that you have COVID-19, and you need to take the appropriate steps to ensure that you do not spread this infection to your family and your friends and your workmates alike.
The public is reminded that there is no cost for COVID-19 testing conducted as part of measures to manage the public health crisis. Persons who have been exposed to the virus should call the COVID-19 hotline at 538-4787 or 458-4787 or contact their nearest health center.